اتفضلي.
Okay, we will talk now about a protocol for digital smile designed computer-aided surgery in all-in-4 rehabilitations. As we know, all-in-4 is a common approach to deal with patients with moderate to severe bone atrophy. We utilize 4 implants, 2 implants axially positioned in the anterior region and 2 inclined implants in the posterior area. So the authors of this study performed a fully guided surgery with digital smile design for patients indicated for all-in-4 approach or technique. Okay, so the first visit was for screening the patients. So they did initial examination and obtained alginate impressions to construct occlusal rims. The second visit, they took photos for the edentulous jaw, and then they functionalized the occlusal rims. They verified the vertical dimension. They made the midline and the canine lines. And then in the third visits, they take photographs for the occlusal rims positioned in the patient's mouth. So these markers can be used to aid in digital smile design and for the as a landmarks to merge these photographs with the SCL file later on. They also took extraoral photos with the occlusal rims for digital smile design. And then 2D digital smile design was performed using smile design software. After they finished the smile design, they obtained the cast that they made from the alginate impressions and the occlusal rims, and then they scanned them together, and then they merged the data from these scans with the 2D digital project with the CAD software, and then with this data they designed a provisional restoration for a mock-up. Okay, until now no CBCT was made or was obtained from the patient. Okay, so the fourth visit was for the mock-up testing to verify or to make sure that the aesthetic requirements are met. And then they added radiographic markers to the provisional restoration, and then they sent the patient to obtain a CBCT or to take CBCT. And then now we have the data from the CBCT and the data from the STL file superimposed in the software. And then now the virtual model is ready for implant or for digital implant planning for the restoration. And then here they designed the surgical guide and they designed the exact position and size of the implants. The abutments in the restoration were also designed. And then they fabricated a stereolithographic model, the one we see here in the picture, with implant analog in place. This will aid in the adjusting the provisional restoration. And then they also printed the surgical guide for the fully guided surgery. And the fifth visit was for the surgical execution, the surgical phase, and the immediate loading of the prosthesis. So here, as we see, the surgical guide was fixed in place and the implant were placed through the guide. After implant placement, temporary abutments that were previously selected during the planning phase were placed, and then the mucosa of the patient was isolated with rubber dam to prepare it for immediate loading, and then the provisional restoration was relined directly with pink cold resin and then sent back to the lab to refine the prosthesis and to remove the palatal portion. Okay, after 4 months, the patients were ready for the prosthetic rehabilitation for the definitive restoration, which were made with monolithic zirconia using the CAD/CAM technology. And here the panoramic X-ray of the implants in the prosthesis. And thank you.
Thank you very much, Dr. Afaf, for this beautiful presentation. And we'll stop here and we could begin our next part with my comments in a moment.